castor oil really dissolve floaters? Hello, everyone. I am Dr. Rupa Wong, board-certified ophthalmologist and managing partner of Honolulu Eye Clinic, where I've been practicing for 15 years. On this channel, we talk about eye health, eye surgery, a little bit about my life here in Hawaii, and eye makeup health. So if any of that interests you, make sure to hit the like, follow, and subscribe button. Castor oil is everywhere. Its benefits, and especially on social media. There have been a lot of videos about how castor oil improves vision, melts away cataracts, and dissolves floaters. If you have a floater, you know how pesky that is, and so it sounds too good to be true. Well, let's break it down. In this video, I'm going to be discussing what is a floater, what are the benefits of castor oil, and treatment options for floaters. So let's get to it. First, what exactly is a floater? Well, the technical term for a floater is a posterior vitreous detachment. The inside of your eye is filled with a jelly. It occupies about 80% of the volume of your eye, and it's called the vitreous. When you're young, that vitreous is firm like jello, and as you get older, it starts to liquefy and dry up. As it starts to separate from the retina, you can start visualizing these floaters. Some of them are extremely annoying. They're right in the middle of your field of vision. Sometimes they are also accompanied with flashing lights or a change in your vision. Because the vitreous gel is typically attached to the retina is the sensitive camera film of your eye. Because it's attached at three main points, when it starts to separate from that inner lining, sometimes it actually can pull a little piece of the retina with it and cause a retinal tear or a retinal detachment. This is why if you're experiencing a new floater, you absolutely need to see your eye doctor. We can then dilate your eyes and figure out if there's accompanying retinal tear or retinal detachment, which happens in about 15% of individuals. Most of the time, we just see the floater and there isn't anything to do, which is why you're watching this video. But some of the time we do find a retinal tear or detachment, and emergency laser surgery or actually surgery in the operating room is necessary. So that is why don't wait on a new floater. Get in to see your eye doctor within a week. All right, so then let's talk about castor oil. How in the world is it going to help a floater, which is located on the inside of your eye? Well, castor oil comes from a plant, Ricinus communis, and it's a humectant, meaning it likes to grab water. It's very moisture rich. It has a lot of monounsaturated fatty acids, and it's very thick. Hydrogenated castor oil is present in a lot of different cosmetics. It is available in shampoos, conditioners. Think about anything where you're trying to boost moisture. That's where you're gonna find it. So, does castor oil help dissolve floaters? Well, I just told you that castor oil is really thick and it's very viscous. So if you were to put a drop of castor oil in your eye, what it does is just stay on the surface of the eye. Now, there are different types of eye drops that penetrate the eye, but they have been specially formulated to penetrate that clear dome-shaped covering of the eye, the cornea, to actually take effect on the inside of the eye. Castor oil is not formulated to do so, so it just sits on the surface of the eye. In addition, most of the time the castor oil you're using is not sterile, so it's not a great thing to be putting inside your eye. So there's absolutely, unfortunately, no scientific evidence that castor oil can help with floaters or even cataracts. In fact, sometimes castor oil has been shown to cause irritation and damage to the cornea by placing it on the eye because it's not sterile. So using it as an eye drop can actually increase your risk of eye infection. Now, there are certain drops that do have castor oil in them, but those drops have been specially formulated and it's not pure castor oil. So that's the big difference. And there are benefits to castor oil in general, just not in terms of dissolving floaters. Although it may not help with our vision, there is some evidence that shows that castor oil might help with eyelash health. Notice I didn't say eyelash growth, but health. And the reason for that is the castor oil can condition the lashes so that they don't fall out so quickly, but they don't actually cause the lashes to grow faster as a prostaglandin type lash serum like Latisse or Lash Boost or any of those. Not that I recommend them, but those actually will cause the lashes to grow. But undiluted castor oil can also have side effects on the skin. So you do want to be careful about the type of preparation that you use on eyelashes. There is a particular brand that I like that was developed by an ophthalmologist. I'll put it in the show notes below, which does have castor oil in them. And there are a few other lash serums that also have castor oil, and I'll post them in my videos as well. Castor oil has also been shown to be helpful in treating dry eyes and meibomian gland dysfunction. The meibomian glands are the oil glands that are located near the top and the bottom lashes. They make the oil for your tears so your tears don't evaporate so quickly. It's very important in maintaining a really perfect equilibrium to creating the perfect tear that hydrates and lubricates the surface of your eye. When you have dysfunction of those meibomian glands, you often get dry eyes. And castor oil has been used in certain eye drops to help with that. But again, that's a special formulation and it's not undiluted pure castor oil. So then getting back to floaters, what are your treatment options? They are annoying, and unfortunately, most of the time your eye doctor just says, well, your brain's going to adapt to them. And that can be true because with time, gravity will take over and usually the floaters will start to settle down and your brain ignores them. But unfortunately, for the unlucky few, some just keep seeing the floaters despite many years after having them. So there are two treatment options. Both are not without risks. The first is a YAG vitreolysis. This is when an ophthalmologist uses a laser to disrupt the floaters. This is also the same laser that we use after cataract surgery to remove the after cataract. Some people call it a secondary cataract, but the real medical term is a posterior capsular opacification. Some people who have had this YAG laser disrupt the floaters, some have noticed an improvement in vision and some have not noticed any improvement at all. The risks include damage to the retina if the laser is improperly aimed. So again, not without risks. The second treatment is called a vitrectomy. And this is when an ophthalmologist, specifically a retina specialist, so one that's fellowship trained, done extra training in retina specifically, goes in and removes that vitreous gel from the eye. This is also a procedure that they do for retinal detachment surgery. They make very, very tiny little incisions that are quite small, smaller than a pencil, and they suck up all the vitreous and then replace it with either oil or a gas, sometimes air. The thing is that the surgery may not remove all of the floaters, and sometimes new floaters can develop after the surgery. The biggest risk for this procedure is that it's surgery, and you can develop bleeding, infection in the eye, and even retinal tears and possibly lose vision. It's a very low risk of losing vision, but it is a possibility because it's surgery within the eye with instruments. So there you go. Does castor oil help dissolve floaters? Unfortunately not. No scientific evidence showing that it does, and there's really no mechanistic way that it can penetrate the cornea, though I am actively waiting for an eye drop to be formulated that will help with floaters because I know that they are very, very annoying. You can also check out my video about pineapples and floaters. And if you have any questions, comments, drop them below. I'm happy to answer them. Or if you have suggestions for other topics you'd like for me to discuss, drop them as well. I read every single one. Until next time, I'm Dr. Rupa. Bye for now.